In the middle of the Black Death, entire cities across Europe began to disappear under the shadow of a mysterious and terrifying disease. People died within days, sometimes hours, leaving streets silent and homes abandoned. But the horror did not stop with the sickness itself. In desperate attempts to stop the spread, authorities created harsh quarantine zones. Sealed houses, guarded streets, and isolated blocks where the infected were forced to remain. Once someone was locked inside, leaving was often impossible. Families were separated. Doors were sealed. Guards stood watch to ensure no one escaped. Inside these quarantine blocks, fear, illness, and desperation created some of the darkest moments of the plague years. Stories rarely told in full by history. When the Black Death began spreading across Europe in the 1340s, cities were completely unprepared for the scale of devastation that followed. Entire neighborhoods were suddenly filled with sickness, and death spread so quickly that traditional methods of caring for the ill collapsed. In crowded cities like Florence, Venice, and London, the disease moved through homes, markets, and churches with terrifying speed. Within days of infection, victims developed high fevers, weakness, and the swollen lymph nodes known as buboes that gave the disease its name. As panic spread, local authorities began implementing extreme measures to control the outbreak. One of the most common strategies was the creation of quarantine blocks. When a household showed signs of infection, officials sometimes ordered the entire building sealed off. Wooden boards could be nailed across doors. Guards might be stationed outside to ensure no one left the building. In theory, this was meant to prevent the disease from spreading to the rest of the city. In reality, it often trapped the sick and the healthy together. Families with a single infected member suddenly found themselves locked inside crowded homes with no medical help and limited supplies. The fear of these quarantine orders became so strong that some people tried to hide early symptoms, hoping to avoid being sealed inside their own homes. But secrecy only made the situation worse. When the disease eventually became visible, entire buildings could already be infected. At that point, quarantine was no longer prevention, it was containment. Inside these sealed houses, life became a struggle for survival. Food deliveries were sometimes left outside the doors, but supplies were inconsistent. In many cities, the sheer number of infected households made it impossible to support everyone properly. Some families went days with little food or clean water. Meanwhile, the disease continued to spread within the walls. People cared for sick relatives without any understanding of how the plague was transmitted. Close contact, shared bedding, and cramped living conditions made infection almost inevitable for many households trapped in quarantine. The psychological toll was just as devastating as the illness itself. Imagine hearing neighbors coughing through the walls, knowing that guards stood outside to prevent anyone from leaving. Every new fever inside the house could mean another death sentence. And as the plague tightened its grip on medieval cities, these quarantine blocks became silent prisons, places where survival depended not only on luck, but on endurance in the face of overwhelming fear. As the Black Death tightened its grip on cities across Europe, quarantine policies became harsher and more organized. What had started as desperate attempts to control infection slowly evolved into a strict system of isolation that reshaped daily life in plague-stricken towns. In many cities, once a house was suspected of containing the disease, officials marked the building so that everyone would know the danger within. Guards or watchmen were stationed outside the doors day and night. Their duty was simple but terrifying: ensure that no one inside escaped. These guards were not healers or helpers. They were enforcers. Residents inside quarantine blocks often found themselves cut off from the outside world. Windows were sometimes sealed, and doors were reinforced or nailed shut. Even if someone inside recovered from the illness, they could remain trapped for weeks because authorities feared the infection might still linger. Inside those walls, time seemed to slow. Food and supplies were occasionally delivered, but conditions varied greatly depending on the wealth and organization of the city. In prosperous trading centers such as Venice, authorities attempted to create a structured response by distributing food through guarded checkpoints. Yet even these efforts struggled under the overwhelming number of sick households. In poorer districts of cities like London, help was far less reliable. Families trapped in quarantine often had to ration whatever food remained in their homes. Water could become scarce, especially in buildings where wells or public fountains were normally shared with neighbors. With doors sealed and movement restricted, basic survival quickly became a daily challenge. The physical environment inside these quarantine houses grew increasingly grim. As the illness progressed, victims suffered intense fevers, weakness, and painful swellings. Without trained physicians or proper medical knowledge, most families could only watch helplessly as loved ones grew worse. Medieval medicine offered few real treatments, and fear of infection meant that many doctors avoided direct contact with plague victims. This left ordinary people to care for the sick themselves. Rooms once filled with ordinary household life became spaces of suffering and anxiety. Families moved mattresses together to watch over relatives through the night. Others isolated the sick in separate rooms in the hope that the disease might spare the rest of the household. But the plague rarely showed mercy. Even those who remained healthy at first lived under constant psychological strain. The sound of coughing in the next room, the sight of new fevers, or the sudden weakness of a family member could signal the beginning of another tragic loss. Outside the houses, city life continued under a cloud of dread. Carts carrying the dead moved through the streets. Church bells rang frequently for funerals. Entire neighborhoods slowly emptied as more homes were sealed or abandoned. The quarantine blocks became silent symbols of the city's struggle, places where people waited in uncertainty, hoping either for recovery or for the moment when the doors would finally open again. But for many trapped inside during the Black Death, that moment never came. Inside the plague quarantine blocks, the atmosphere was one of fear, despair, and relentless suffering. Walls that had once contained warmth and family life now held illness, death, and silence punctuated only by coughing and groans. Every day became a fight not only against disease but against hopelessness. Families huddled together in tight spaces, trying to care for the sick without the tools or knowledge to stop the spread. Bedding was shared, clothing reused, and water rationed. The very act of helping a loved one could mean certain infection, yet leaving them unattended was unthinkable.
Survival demandait d'impossibles choix.
The psychological toll was immense. Children witnessed parents growing weaker, and parents watched helplessly as siblings succumbed. Fear compounded grief, and anxiety became constant. Many recorded in private notes or letters that the walls seemed alive with whispers of death, neighbors dying room by room, cries echoing through corridors, the quiet footsteps of guards keeping watch. In some cities, authorities enforced additional brutal measures. Anyone attempting to leave a quarantine block faced severe punishment. Guards were often armed and instructed to prevent escape at all costs. In extreme cases, entire families could be forcibly removed or confined if they were suspected of violating the rules, sometimes dragged into carts with the dead to be buried in mass graves. Despite these horrors, resilience persisted. Some households managed to survive through careful rationing, mutual support, and sheer luck. Women often became the primary caregivers, risking their lives to tend the sick while organizing scarce resources. Their resourcefulness and endurance sometimes meant the difference between life and death for the rest of the family. Hunger and exhaustion were constant companions. Food deliveries were irregular, and with the streets under heavy guard, there was no way to supplement meager supplies. Contamination of water or food could spread disease further, forcing people to make agonizing decisions about who received what and when. The quarantine blocks also created a stark social divide. Wealthier households sometimes fared better, able to pay for food deliveries, protection, or temporary physicians. Poorer families endured extreme deprivation, often dying alone or in small clusters within the same confined space. The plague was indiscriminate in infection but brutally unequal in survival chances. Religious and spiritual life inside these blocks became both a solace and a source of fear. Families prayed desperately, lighting candles and murmuring prayers, hoping for divine intervention. At the same time, superstition flourished. Some believed the plague was punishment for sins, which created guilt and shame alongside fear. In this silent and deadly confinement, every day became a grim calculation. Could someone survive another night? Would the next cough signal the end of a family member? And even if one emerged alive, the trauma and loss left indelible scars, haunting survivors for the rest of their lives. The quarantine blocks were more than a medical response. They were the stage for humanity at its most vulnerable. They revealed the limits of human knowledge, the cruelty of circumstance, and the remarkable capacity to endure even in the darkest hours of history. As the Black Death raged on, some cities attempted to impose more systematic quarantine measures, establishing entire districts or streets as plague blocks. These were segregated areas where the infected were forcibly confined, sometimes for weeks or months, until authorities deemed the risk of contagion had passed. In these blocks, life was even harsher than in individual households. Multiple families were often confined together, and space was minimal. Cramped conditions meant that disease spread almost inevitably, and the weak or elderly rarely survived. Wooden partitions, where used, offered little protection. The boundaries of these quarantine districts were strictly enforced, patrolled by armed guards who ensured that no one escaped, even to find food or water. Hunger became a constant companion. While cities tried to supply basic rations, the sheer number of confined people made it impossible to feed everyone adequately. Families rationed scraps, sometimes hiding small portions for later, while illness slowly weakened those who had once been strong. In some cases, neighbors outside the block refused to help for fear of contracting the disease, leaving those inside isolated and desperate. The psychological weight of confinement was immense. Families grieved openly for the dead, sometimes stacking corpses in corners before city. Workers could collect them for burial. Fear and paranoia thrived in these close quarters. Suspicion could tear households apart. One cough or a rising fever could make a neighbor a target for blame. Women often bore the heaviest burden. Tasked with tending to the sick, preparing meager meals, and comforting children, they worked tirelessly, sometimes at the cost of their own lives. Their strength and resilience became the fragile backbone of survival within the quarantine blocks, demonstrating extraordinary courage under impossible conditions. Superstition and religion became intertwined with daily life. People prayed constantly, lit candles, and performed small rituals to ward off the disease. At the same time, some believed neighbors were cursed or responsible, creating tension and fear even among those who were physically unharmed. Despite these unimaginable circumstances, human ingenuity and compassion occasionally shone through. Some prisoners shared food, comforted the sick, or created makeshift sanitation systems to slow infection. These small acts of solidarity could make the difference between life and death in a place otherwise dominated by despair. Yet the reality was grim. Many who entered these quarantine districts never left alive. For the survivors, trauma lingered long after the disease subsided. The memory of locked doors, isolation, and the constant presence of death would haunt them for years, shaping their communities and families for generations. The plague blocks reveal the stark intersection of fear, disease, and human resilience. They were more than a response to an epidemic. They were a crucible where courage, suffering, and survival were tested to the utmost limit, leaving a legacy of human endurance etched into the darkest chapter of medieval history. By the final years of the Black Death, the scale of suffering inside the quarantine blocks had reached staggering proportions. Entire streets, neighborhoods, and sometimes districts remained sealed for weeks, as authorities attempted to halt the relentless spread of disease. The physical and psychological toll on the residents was immense. Inside these blocks, death was a constant presence. Families buried their own in hastily dug pits or stacked corpses in corners for city workers to remove. The air was thick with the stench of sickness and decay, and fear was omnipresent. Even those who avoided infection were traumatized by the constant reminders of mortality around them. Survival often depended on resourcefulness. Women and men alike devised ways to stretch meager food rations, maintain some semblance of hygiene, and care for the sick with whatever means were available. Some households established rudimentary systems of communication with guards to request supplies, while others risked secret exchanges with neighbors outside the block to obtain necessities. The social dynamics within quarantine blocks were complicated and sometimes brutal. Close quarters bred tension. Fear of infection created suspicion, and arguments over food or caregiving duties could turn violent. Yet even in this extreme stress, acts of compassion persisted. Small gestures of kindness, sharing of resources, and whispered words of comfort became lifelines amid despair. Children and the elderly were particularly vulnerable. Many did not survive the harsh conditions, and those who did often carried lasting physical and emotional scars. Entire family structures were decimated, leaving survivors alone in a world irrevocably altered by plague and confinement. Despite the devastation, quarantine blocks played a role in slowing the spread of the disease. Authorities learned, however imperfectly, that isolation could limit contagion. The measures were harsh and often cruel, but they were one of the few tools available in a world with limited medical knowledge. In the aftermath, cities struggled to rebuild. Survivors emerged into streets emptied of neighbors, markets, and homes. The trauma of confinement, hunger, and witnessing death lingered for decades. Those who had lived through quarantine carried the memory of locked doors, guarded streets, and endless illness, a human cost rarely captured in official records. The story of these plague blocks reminds us that epidemics are not only battles against disease but also against fear, isolation, and the breakdown of social life. They reveal the extremes of human suffering, the limits of authority, and the resilience required to survive in the face of overwhelming mortality. Though centuries have passed, the lessons endure. The Black Death was not only a medical catastrophe but a profound social and psychological trial, leaving a legacy of courage, endurance, and the stark realities of life inside the most horrific quarantine blocks.